We have partnered with Dignity Health to provide information about colon cancer, and back with us today is Dr. Najafian, Director of the Colorectal Center at St. Joseph's Westgate Medical Center. And so, Doctor, welcome back.
Thanks so
how
much
are
for
you doing?
having me. Great, thanks.
So, last time we were talking about young adults and how colorectal cancer is starting to affect younger and younger people.
Yeah.
And that's something that you really want to get across, that it's time for everybody to get checked, right?
Yeah, I mean, at least to be aware of the risks of colorectal cancer in younger adults. You know, there's a study that came out a few years ago by the American Cancer Society and the National Cancer Association, and the study was basically based that if you were born in the 1990s, you were twice as likely of developing colon cancer than if you were born in the 1950s. And you were 4 times as likely to get rectal cancer if you were born in the 1990s versus 1950s. And this was a few years back, so that number may have also increased more recently.
Why do you think this is happening? Why are people starting to get this type of cancer?
You know, it's we have to first understand that actually the whole risk of colorectal cancer has decreased over the years, right? So in 2017-18, it was 1 out of every 17 people would get colon cancer. Today, it's 1 out of every 20, and most of those, the improvement has been made over the age of 50. Unfortunately, under the age of 50, there has not been much improvement and actually increased risk. Now, why is that? Obviously, genetics is a big factor. Inflammatory bowel disease, Crohn's disease, ulcerative colitis, those kind of factors. And then foods we eat, certain types of environmental factors that are affecting us. One of the things that's increasing, that we're seeing association with, is obesity, is associated with it, smoking, alcohol, red meat. It's been associated with colorectal cancer. All these are possibilities.
Yeah. Okay, so if someone's at home right now, say they're in their 20s, what's something they should be looking at to see what's going on with their body and some warning signs there?
I'll tell you, every single patient I've ever seen in their 20s and 30s have had symptoms for a few months. And some of them have reached out and tried to get help, but unfortunately, they were kind of told that most likely it's just something benign, like hemorrhoids. I think you have to be very vigilant. If you're really having rectal bleeding, for example, you know, you have to be your own advocate and really go out there and say, you know what, I need to be checked. I want to get a colonoscopy done and be checked. Is colonoscopy the only option? No, colonoscopy is not the only option. There's other options too, but that's the gold standard.
Yeah.
There are other tests available, though, if you are very uncomfortable of having colonoscopy. It's better than nothing, but colonoscopy is still the gold standard.
Yeah. And I think also, too, you want people to start talking about this. You want younger people who are going through this to start talking to younger people, and that's another way of preventing this, so also getting the help they need.
Exactly, exactly. I think that's huge, and us talking about it, hopefully it helps. Just
Yeah, which is so important. Okay, so let's talk about a screening.
Yeah.
You know, we hear these stories, don't we? Like, oh my goodness, I got to go in for a colonoscopy, and oh my God, it's going to be. But it's not.
Right.
You know, at Dignity Health, they walk you through it, they talk you through it,
Yeah.
and it's not what everyone says it is it?
Right. No, you know, actually, I had my first colonoscopy just a few years ago. And I'll tell you, you know, I was the same way. The biggest thing for me is losing that control of being put under. And I didn't want that. But honestly, it was the best thing I ever did, because there was a large polyp they found in me, and they removed it. And that was a precancerous polyp they found in me. And I had really no symptoms. And that's when you want to go in, when you have no symptoms. When you're actually having symptoms, then there could be more advanced. So for someone who's 45 and has no symptoms, they need to have a colonoscopy. If you're under the age of 45, and if you have family history of colorectal cancer, you should definitely talk to your physician about getting colonoscopy done. Also, if you're having symptoms, you need to talk to your physician. And if you're still not happy with those answers, then you need to seek help other places.
Other places do that. Okay, so now I know we got a couple minutes here, because we got to wrap up, but I don't want to do that, because I want to ask you, after you've gone through your colonoscopy, and you do find out that you do have colorectal cancer, what are some of the things that you take people through to help them?
You know, first thing is that hope. There's hope. You know, it's colorectal cancer is not something that for most people, it does not kill them. There's good treatments, there's good cure rates, prognosis. The earlier we find them, the earlier they're diagnosed, the better. Most patients come into my office with colorectal cancer diagnosis, and they're very upset, very sad, understandably. But I tried to explain to them that it's better to know than not to know. Now we can actually go ahead and take care of this problem versus if you didn't have that colonoscopy and it would just been growing inside of you.
Yeah.
So I think it's one of those things that I think you have to just have patients to understand that there's hope for them.
Yeah, that's very good.
Yeah.
It is, of course, Men's Health Awareness this week, and it's a great time for men out there, your family,
Yes.
to go give a call to your doctor to check about yourself and get a colonoscopy.
Absolutely.
So there's nothing wrong with it.
Absolutely.
Doctor, remind people where they can find information more about, of course, everything we talked
I think there's going to be a link on this screen that you're going to be able to see, and also a phone number that you can call. And screening colonoscopies, you can get a doctor through this line that they can direct you to, that locally that can get in touch with for colon screening.
Perfect. Doctor, thank you very much for joining us.
Thank you very much.
Thank you. And again, we'll have the information right there on the screen, also on aztv.com.